Let's see. Submit a couple more people. All right. So we're going to go ahead and get started here. I think there'll be some other people popping in, but so today we're going to talk about injury prevention, and I'm, for you don't know me, I'm Ashley Austin. I'm one of the professors of family medicine and sports medicine here at the University of Washington. For those of you who are fellows, I was just a fellow last year, so totally understand the fellow journey, and I'm glad you all were able to join, and we've been getting these lectures together. It's been really nice. So I'm going to go ahead and just get started here. All right, so to start here, let's see. Okay, so I have no disclosures. The objectives of the talk today are going to be to define primary, secondary, and tertiary injury prevention, to review risk factors for injury, to explain patterns of injury that you can see throughout a typical season in a sport that you're covering, highlight several components of pre-workout preparation and their effects and how they can affect injury prevention, discuss anaerobic training, and then at the end, sort of to summarize the principles of overload and how to avoid kind of overtraining syndromes in our athletes. So kind of to start here, we'll talk a little bit about types of injury prevention. And what I might do, I'm going to hold right there just for a second. If you could put your microphones on mute, if you can. I'm getting a little feedback, and I just want to make sure everyone can hear okay. So types of injury prevention. So we have primary, secondary, and tertiary. So primary, this is sort of the health promotion. This is sort of the injury prevention programs that we put athletes through before they really have an injury. This is what we'll be focusing on today for the talk. But for the sake of completion, just talking about secondarily, we can do things like intervening and preventing re-injury after athletes have been injured, and sort of picking up on early diagnoses of various things. One of these things particularly can be something that's pretty common for us in knee pain in athletes is patellofemoral syndrome, and sort of correcting the biomechanics, the hip strengthening deficits that are sometimes there in the athletes that present with that. So preventing re-injury is more secondary, and then rehabbing and correcting disabilities once they form. So let's say an athlete is to the point where they're having to sit out for sport because of various injuries, sort of really honing in on what is contributing to, this. Is it, various, more extreme varus valgus alignment of their knees? Is it, again, is it strength deficits? Is it failure of activating muscles? And this is more of that tertiary rehab again, and that's, we're going to focus more on primary today, but just for completion. So moving on to systemic injury prevention. So these are prevention in when we're looking at teams, groups of people. So let's say first we have to sort of start with step one. And step one is to establish the extent of the problem. So let's say we have, the classic example is we have a team and we're getting a lot of, ACL tears. Those non-traumatic, those non-contact ACL tears are very common in women soccer players, women basketball players. So let's say we say, 2 or 3 players per year are going down with this injury. Well, step two is going to be, what is the etiology? What is the mechanism of this? Are these, are there biomechanical issues that are causing these things? We know women have other factors such as hormones and other things that cause them to be more at risk for these injuries, but sort of honing in on individual and group risk factors. introducing preventative measures, which would be things like ACL, preseason ACL conditioning programs to sort of make those injuries less likely, and then assessing the effectiveness. So then going back and saying, okay, in this following season after implementation, do we have less ACL tears in our athletes? So that's kind of how you'd work through that step by step. Things to keep in mind while you're doing this are things like different risk factors for injury. So this can be very far and wide. I think first we start with internal risk factors. So that's age, that's sex. Certainly there are injuries that are more common in males and females, body composition, general health, physical fitness, anatomy, and just skill level of sport and what level people have played at prior to coming to college, and kind of the demands on their body. And then external risk factors are things like, what protective equipment do people have? Um, you know, uh, what sort of sporting equipment are available to people? What conditions are they playing in? Are they playing at altitude? Are they playing in snow? Are they playing in ice? Are they playing on turf versus grass? And these kinds of things start definitely playing a role. In addition, you have kind of playing situation, which can certainly vary depending where you are in the season. So things like, is this a championship game, or is this the first game of the season? Is this a conference game? Is this a non-conference game? Any athlete will tell you they get more amped up for conference games, rival games, things like that. Um, Looking at sort of that whole spectrum of things is very important when assessing risk factors for teams. So then we sort of step into the injury risk profile during a season. So this sort of goes in several steps. So the first step of this is going to be your basic training. So the beginning, before any season sort of happens, there's this period of time where you're doing basic training, and this is usually athletes have spent time at home, maybe doing home programs that they've done, potentially maybe even done some summer school, had some kind of pickup games or other sort of lifting things on their own, but not as much control by coaches. And then you get into this period of basic training. So athletes are, if they're coming from East Coast, they're having to adjust to time zones, they're having to adjust to sort of whatever off-court training they were doing. And then oftentimes, even if they were doing programs, it's going to be a little bit different once you get back to school, altitude, heat, and humidity. I know for me, when I played college sports, I was in Indiana, and when I'd go home for the summers in Georgia, I was used to a lot of heat, a lot of humidity, and when I went back to Indiana, I actually found it easier to perform with less humidity as a change. So athletes definitely, that can be pluses or minuses for them depending. But this is kind of the point in the season where no athlete likes. I know for basketball, this is often a time where they're doing individual workouts with coaches. This doesn't look like a lot of fun, but this is kind of the first step in the steps to getting ready for competition. After that, we're looking at things like training camp. So training camp, finally, you have, instead of individual workouts, you're now able to have teams practicing together. You get everyone at once. Coach's attention is not just on you, but it's kind of on the whole team. You're doing weight workouts. You're having to, again, adjust for different training surfaces. So now we're spending more court time than we would previously if you're playing a court sport. And then you're now having to adjust to back-to-back days. Usually in the other aspect, the basic training, you're not doing back-to-back days all the time. You're usually having some rest days in between. This is going to be more back-to-back days to build endurance. And then we move into the section where everyone likes, which is the competition or the icing on the cake. And this is very high tempo. This is very high octane. And you can imagine injuries in this part are usually occurring at the beginning or the very end. So at the end of the season, we're looking at overuse injuries. In the beginning of the season, everyone is very amped up, and everyone is, once people have worked sort of in this training camp spot where they've been working really, really hard to earn positions and earn their spots, and that's a high risk time for injury as well. Now we're moving into this competition where you're taking all that and now you're exploding into the season. So often there are a lot of injuries in the beginning of this part of competition and towards the end. So then we look at a rest period, and hopefully it's been suggested that a 4 to 6 week period is a good time frame for that. And generally athletes will take, a few weeks off, and then maybe even start some light training towards the end of this. So moving into that, we'll have to look at a little bit more about how are we preparing people as far as you know, their pre-workout preparation. 1 second here. All right, sorry. So sorry, just admitting a couple more people. So as far as pre-workout preparation goes, sort of looking at how we're getting ready to perform in these games. If I had a couple people just add to the lecture, if you guys wouldn't mind just putting your microphone on mute for us, just so we don't get any feedback from you. Thank you. All right, so as far as moving next is into pre-workout preparation. And so things we consider in this period are things like warm-up. So if you've been to a sporting event, if you've played sports, you know there is a period of time that you warm up before an event. The ideal time frame for this is about 30 minutes before the game, and it's been shown that the effects and the buildup and the benefits of having a warm up are starting to decline around the 30-minute mark. So these warm-ups are often combined sport-specific and non-sport-specific. So things like, you know, soccer, as you see in this picture up here, we have soccer players. They usually have a combination of sport-specific agility drills with the soccer ball dribbling. But they also incorporate some running as well. So they're getting some cardio and some technical things in prior to the game. The benefits of this is increased oxygen delivery to tissues and muscles, decreased vascular resistance, increased metabolism, mechanical efficiency, getting your muscles ready, getting the stiffness of the connective tissues out so the muscle fibers are able to fire in nice uniform ways and getting that muscle recruitment that you want, and then increased nerve impulse speed, which can contribute to reaction time. So as far as stretching goes, I have just a quick true or false question for people who are able to plug into the chat. So pre-exercise stretching, does it prevent injury? True or false? So true or false, pre-exercise stretching prevents injury. I'm gonna go ahead and open this up for chat, and I'll take a few answers on chat and see if anybody is able to answer for me. I appreciate anybody that contributes. Thank you very much. So we're getting pretty much across the board that this is false, and that's absolutely correct. So in general, when we're talking about stretching, there is no existing evidence that pre-exercise stretching, with or without a warm-up, that it decreases overall injury rate. So that's really something important to know. And in actuality, it actually decreases joint movement efficiency. So if you think about it, if you're doing an event where you need a really strong biceps contraction and you have your arm and you're contracting and your arm is very strong in that position, if you do a really heavy stretching exercise prior to doing that, then that contraction is going to be less because you've now lengthened the muscle. And so you're getting less of a contraction than you've been trained to have. And so kind of think of it that way, as you actually end up doing yourself a little bit of a disservice by doing that. What they did find, however, though, and the strongest data we have out there is to say, and it was a study done in firefighters, but regular stretching routines tends to be what causes a reduction in injury. So they did this in firefighters, and I believe military officers as well. There was a 32% reduction in injury when they had regular stretching. So it's more about having regular stretching than the pre-workout stretching. So one other question for you guys, just to make sure people are out there. So stretching. So when we're thinking about stretching, and I think I have a little typo here, but the question is, how does strength, power, and endurance change when someone without a regular stretching routine acutely stretches before an event? So this you should be able to answer based on what I just told you, but I'll again open it up for chat and just see if people are filling in there. Oops, sorry. Yep. So again, thanks for answering. So yes, your strength, your power, and your endurance all all will decrease when you're doing just acute stretching before an event, and if it's not in your regular routine. So really keep that in mind. I really wanted to hammer that home. So types of stretching. So there's different types of stretching. There's number one, there's static stretching, which is really holding a position gently for 30 to 60 seconds. This is usually going to be pain-free, and this is the least amount of tension and the safest method for increasing your flexibility. So I'm going to give you guys a couple of just reminder videos on these. So first for static stretching. So this is an example of static stretching. This is literally just holding a position, not very, very gentle, not worried, not wanting to really cause a lot of harm here. So that's an example of static stretching. Now you'll also have things like ballistic stretching, and ballistic stretching is stretching near the limit and then further bouncing movement. And this is usually performed by gymnasts, ballet athletes, dancers. They have really high muscle contraction after they kind of have a bouncing movement, and they try to push themselves into furthering their extent of flexibility. This is usually one of the more dangerous ways to do it, but an example of ballistic stretching is here. So that bouncing movement, as you see, so that's more ballistic stretching. And then the last type of stretching, let's see if I can get rid of that here. And then the last type of stretching is this proprioceptive neuromuscular facilitative stretching. So big, long word, but essentially it's just an alternation of contraction relaxation in order to gently move your antagonist and agonist muscles to get a really good stretch in. This is usually done best with partner stretching. And usually what you have people do is the classic, and I'll show you kind of a video of this as well. But the classic way you're sort of looking at this is having someone, so this is someone's hamstring, you have their hamstring getting stretched up, and then you have it to the point where they start feeling the stretch, you hold there and actually have them push against you, contract their hamstring, and then you have them relax, and after the relaxation period, you're usually able to push them a little bit further. So hopefully we can catch here where he moves a little bit further. And then you can see him moving now. He has even more flexibility in his hamstring, and he's able to move them a little bit further along. So that's the goal of that type of stretching. All right, so moving a little bit into taping and bracing. So this is something that we're oftentimes having our athletic trainers do before games and matches. Typically, we have people, there's some athletes that prefer bracing, there's some that prefer taping. Taping does require a lot of effort from athletic trainers and a lot of preparation prior to games. But the important take homes here, there's no role in primary prevention for shoulder, elbow, knee, or spine with taping or bracing. And we are still doing it in a lot of our athletes, but sometimes if we were to really look at the data behind that, and athletes feel comfortable with having things on them, but we really don't have great data to show that that's helpful for primary prevention prior to an injury. We do have good evidence for bracing in those with history of ankle sprain, which would be secondary prevention, and also some knee bracing. We have some data with secondary prevention. Again, with tapering and bracing, your goal is going to decide, are you restricting motion and are you working on proprioception? The reason that matters is, certainly tape does loosen up over time. You may be losing that benefit of having restricted motion. So then is the tape at that point working more for proprioception? I think that's kind of where we are with sort of knowing what we're actually getting out of taping and bracing. So for taping, I was just want to go over just a few pros and cons of that. So, 1 second here. So some pros of taping are athletic trainer supervised. They know exactly how they're locking in the ankle to prevent or to allow for stability. Cons is that it's pretty expensive, can cause some skin irritation. You can have some issues with foot ankle circulation, especially if they have a recent injury to an ankle. And then what's the timing of removing and reapplying? You know, there are some people that will take athletes at halftime, they'll retape them. What's the time frame where the tape starts loosening up? And then what's your goal? Is it stability or is it proprioception? I would argue even tape that's loosened up may give some proprioceptive feedback, but is it providing the stability? And what are you looking for patients? And is it sort of primary or secondary prevention? Bracing, the pros are that it's cheaper long term. It's solo application, so you don't really need the workforce of the athletic trainers doing this. Some cons are you do get wear and tear in the braces, so knowing when to replace them would be important. Finding exact sizes and different weights for athletes would be harder, ankle shapes, and then does it actually slip and slide with use? As an ankle brace wearer, I will say that I noticed pretty minimal slipping of the ankle brace when playing basketball, but it did sort of loosen up similarly as tape sometimes. So you just wonder what benefit you're getting. I would argue that the better benefit was from proprioception throughout the whole event. Other environmental factors, things to consider is, when you're performing on court or field surfaces, certainly field athletes have a little more give on their surfaces. When you're moving from softer, grass surfaces, track surfaces to concrete, there's a big demand on the body. So when you're walking on concrete versus softer surface, you have 2 times your body weight is the force that's going through your joints. When you're running, it's 3 to 4 times your body weight is the ground forces that you're feeling. And then when you're jumping, it's about 5 times. So that's also something to consider, especially when you're thinking about training workouts for athletes, endurance athletes, sometimes doing track workouts instead of always on concrete, varying it up, maybe doing trail runs instead of just runs down the street. So the last part we'll talk about is just understanding these in-season workout regimens. And the important concept here is going to be periodization. So periodization is the cycling of aspects of the training program depending on where you are in the season. So this can definitely vary by sport. For instance, when you're in the preparation conditioning portion of when you're getting your athletes ready, so this sort of basic training aspect, you're usually doing the most amount of aerobic training and weight training. You typically technique and that sort of stuff comes a little bit later, but you definitely want your athletes to be in shape. They're going to be, working pretty hard on the plyometrics, those fast bursts, those endurance bursts, building up their endurance. When you're moving more into the transitional pre-competition phase, this is more technique work. So you'll notice technique goes up. You're still doing some anaerobic training, but the aerobic training, you've now settled into a nice routine with that. And then when you're getting into competition, so this is like during season, you don't want to burn people out too much. So to maintain people from match to match or meet to meet, you're usually working on technique training. You're working in this competition mode where you're having spurts of high intensity, and usually the aerobic training stays at your basic training level, but just by having high intensity events, they're maintaining the cardiovascular fitness that they need. So looking a little bit more into sort of aerobic versus anaerobic exercise. So aerobic, as we know, this means with oxygen. In general, this is increasing our general fitness, our aerobic capacity. We measure this with our VO2 max. So that's the max oxygen utilization in a person 1 minute per kilogram of body weight. We can also look at our rate of perceived exertion, which is a chart that kind of gives you, how hard you feel like you're working. The best effects of training effects that we see come somewhere between 70 and 80% of the max heart rate, and you can calculate that with 220 minus your age. Anaerobic, a little typo there, but anaerobic means without oxygen. So high power, high intensity for short durations of time. You're having a big recruitment of all your muscles, which tries to delay fatigue. And you can sort of train these muscle fibers to sustain a lot of force, but you're doing this over short bursts. This usually has a higher type of injury rate. So for aerobic versus anaerobic, for aerobic with oxygen on the left side of this chart, you can see that you're making, back to our basic science, we're making 36 ATP. This is with oxygen. And when you don't have that oxygen available and you're doing anaerobic activities, the pain that you're feeling, that kind of stuff, is the lactic acid building up in your muscles. As a fellow, I had an opportunity to do some lactic acid testing on rowers, and I noted that rowers could get anywhere between like a lactate level of 10 to 15 during rowing. And rowing is both aerobic and anaerobic, but their lactate was building high, as that's a big anaerobic aspect of their workout. And they were still able to function and then clear that lactic acid during cool downs. So general types of aerobic and anaerobic are brisk walking, swimming, running, cycling. These sorts of things are aerobic. Classically anaerobic is our weightlifting, our isometrics, our plyometrics, our interval training. Popular types of anaerobic exercise for our athletes tend to be these plyometrics, these rapid, eccentric, concentric contractions for like strong, forceful movements. One example of this I'll show you. So this is an example of plyometric activity. And so this is someone doing box jumps. This is high, forceful movements over short periods of time. So that's more plyometric. Other types of things, Olympic lifting. This is very common in the athletic population because you're getting big, large number of muscle groups that can get involved in single lifts, and you can work with strength and power at the same time. So things like that would look something like this power clean that you see from this bobsled athlete. And this is one of the United States bobsled athletes doing a power clean. And as you can see, he can increase both his strength and his power at the same time. Other popular types of anaerobic exercise are things like isometric, and this is good for like injury patients. An example of this would be getting your bicep in a, where you're contracting your biceps and just holding. A second type of thing is isotonic, which is, you have a higher risk of injury, but usually you can get a lot larger range of motion with isotonic contractions. They have a higher risk of injury, a larger range of motion, but this is usually, isotonic is what a lot of our athletes are doing. This goes into both concentric and eccentric. So bicep curl being the concentric aspect and eccentric being lengthening your arm back out to get it straight. The last sort of thing to keep in mind when we're going through all of these things are things like principles of overload. So overload factors to consider are volume, intensity, recovery time. Volume is the quantity and duration that you're doing. Intensity is the quality of how you're doing it. And recovery time is how much rest are you getting? Are you getting rest between sets? Are you getting days in between similar types of activity, and sort of what that looks like? In general, we want to avoid overuse syndrome. So that's things we want to be sure we're slowly progressing into new activities. We're adjusting one factor at a time, usually volume or intensity, but not both. It's usually a red flag if you're adjusting for both, and usually a high risk for injury. Your goals are going to be to increase the work capacity and get improvements without injuring people, and you want to monitor closely for overuse syndrome. So explained in a diagram, we have this sweet spot, and people have probably seen this diagram before. But essentially what we have here is we have, your likelihood of subsequent injury as workload increases. We move into this green area and we can say, okay, this is a sweet spot. Now, ideally, athletes are operating somewhere between the green and the red, but you notice there's very small margin for error. And our best performance usually comes at the edge of this white line, moving into sort of just before you're at risk. That's sort of optimal performance. So you can imagine there's not a lot of breathing room that athletes have before they're injured and performing at a very high level. So these are things we really need to pay attention to. So at this point, I'm going to open up I just have just a couple of review questions here. We'll go through just 1 through 4. And if you're able to stick around just for a minute or two, we'll run through these. So first question here, and these are from the AMSSM review book. So when training for an endurance event, which of the following is the most critical factor to consider when planning a training regimen? And so I'll open up this group chat, and as people answer, So the answer to question number one is actually intensity. And so uh, this sort of goes back to what we were talking about as far as the factors that we want to change. So volume, intensity, and rest and recovery time. So if you keep your intensity at an appropriate level, you're able to pick up on errors in technique. And if you're worried about technique, or if you're doing new exercises, you're wanting to start slow and making sure that everyone has a technique before advancing. So actually intensity is a little bit more important in the starts of this. So question number two, which type of training program provides the greatest improvement in cardiorespiratory fitness? And we did not talk about this directly, but you may be able to deduce this from what we talked about. Perfect. So this answer is B, so high intensity interval training. And the reason that is because moderate intensity continuous training is going to be usually mostly all aerobic. High intensity interval training combines that anaerobic aspects. And many times our athletes are in sports that are both anaerobic and aerobic. So aspects of both. So for question number three, we have a 73-year-old that comes to the office because she heard that flexibility exercises are important for older individuals. Her goal is to be able to maintain her activities of daily living, like dressing and walking. She wants to know how often and when to stretch. Which of the following best summarizes the current recommendations regarding stretching? And we should have covered this in the lecture. Oops, sorry. Perfect. Thanks for everybody for participating. So A is actually the right answer. That's perfect. So flexibility exercises should be performed twice a week. And this again is, when the body's warmed up is important, but it's more of just making sure you stay in a routine of doing it. That's the big take home here. So flexibility is only as good as how often you're doing it and doing it regularly. Last question here. So question number four, overtraining syndrome is poorly understood condition characterized by mood changes, fatigue, decreased performance, accompanied by increased achiness and more frequent injuries. What is the best explanation of the pathophysiology? And again, we did not address this correctly, but this is certainly something we want to try to avoid in our athletes. And we can kind of talk about this answer shortly. Perfect. So excellent. So yeah, E. So overtraining syndrome involves, it's very, very complex. Um, involves many pathways, and the reality is A, B, C, and D are all correct, but all of them contribute. So it's amino acid deficiency and muscle breakdown, it's glycogen depletion and just feeling really tired or not having the carbohydrate stores you need to perform. It's cytokine overload and, oxidative stress to your muscles and tissues. And then it's also hypothalamic dysregulation, which in women can look like, abnormal cycles and things like that. So for men, it can look like decreased sexual performance, other things of that nature. So certainly all those things can contribute. So think about this in an athlete where, they're not getting better with any sort of rehab that you're doing. Consider that it is just an overtraining syndrome and how to address that. So thank you all very much for tuning into the lecture. You are welcome to email me at any point if you have any further questions. And this lecture was recorded, so we should be able to distribute this afterwards. So thank you guys again for joining.